I was a civil engineer. The president of the company, when I retired, asked what I was going to do. And I told him, I'm going to golf, I'm going to spend time with my grandson, I'm going to globetrot with my wife, and then I'm going to golf some more. Played football in high school, and then I started doing marathons. And so I was always active. It was about 8 years ago that my daughters invited me to hike Pikes Peak with them. I was really struggling. That's when I started to wonder something's wrong.
He wasn't getting any answers, and the doctors really weren't digging for any further reason why he had the symptoms.
My primary care provider referred me to National Jewish Health.
National Jewish is the leading pulmonary hospital. We knew that he was going to get the best care.
Well, I first met Daryl. He was very fit, so it was really striking when he was telling me that he couldn't run anymore. Daryl had come to us with a history of atrial fibrillation. As he developed more and more symptoms, there were some abnormalities on his echocardiogram suggesting some pulmonary hypertension, and we wanted to tease out, is this from the pulmonary hypertension or is it related to his atrial fibrillation? It was clear that we needed to do something.
My family means the world to me. I just can't imagine life without them.
I love gardening. You plant the flowers and you water them correctly. You know, they will give that joy back to you. I love that.
Barbara is very much of a nurturer. She values her children and her family most.
My mom has an aura about her and a glow. So when I noticed that light starting to fade, I knew there was something going on.
I had difficulty with breathing. I was severely fatigued.
And over the course of time, sometimes nap for hours during the day, gain her energy and strength back. To see my wife like that and not be able to fix it and not have any idea how to get her better, that was very hard.
And she would say to me, I'm not fun, and I'm a different person.
I can't do what I used to do. How will this affect my family? How will this affect my grandchildren when I've been such a strong part of their lives? So after seeing so many physicians up and down the East Coast, my son, who is a physician in Denver,
he says, Dad, you're foolish looking anywhere else. Why don't you come out here and see one of the excellent pulmonary physicians at National Jewish Health?
When a child with asthma undergoes an asthma attack, they start to feel like their chest is squeezed tight and they're gasping for air.
When Adam was about 11 months old, he had an episode of pneumonia that was incredibly severe. He was then diagnosed with asthma. We needed many ER visits, then began the hospitalizations. Adam's pulmonologist at the time said National Jewish would be a good fit to really see if there's something that we're missing. Dr. Zeitlin could tell a story just from one test.
What a bronchoscopy can offer is a direct look at what's going on inside the airways in the lung. We have a clinical study that allows us to sample the cells from the airway walls. Those specimens are sent to Dr. Seibold's lab to take a look at gene expression.
We've been studying those cells, trying to figure out what is going wrong in the airway tissue of someone with asthma. We found that people with a certain type of inflammation produce mucus with a specific type of protein. Mucus really sticks to the airway and forms this plugging structure that blocks airflow. Identifying that protein produces a target then that we can design drugs to try to break up airway mucus in those patients that have that type of inflammation. And this discovery process is what allows us to make an impact on a patient's disease, and National Jewish is particularly well suited to doing this kind of research.
I think that's a unique aspect of working here at National Jewish Health, where we're not only taking care of the patients directly, but we're also designing and then executing research trials to advance our understanding and treatment of disease.
One of the special things about National Jewish Health is how closely we work with our colleagues and collaborate to figure out what's really causing their symptoms. And that's how we start treating people.
I first met Daryl when he was referred for an exercise heart catheterization. What we learned was that when we actually had him on the exercise bicycle, his pressures increased really out of proportion to what would be normally expected.
And what that test revealed was that when he exercises, he actually has severe pulmonary hypertension. We treated him to help the blood vessels dilate and lower the blood pressure within the lungs. But his atrial fibrillation progressed where he was having more severe episodes, and that's when I referred him over to Dr. Sung.
We decided to try an ablation. I'll burn specific areas of the heart to reroute electrical signals to cure or get control of arrhythmia. He hasn't had any AFib since.
Working with the doctors helped him realize that there are things that can be done to help the quality of life, which has been really helpful for him to go out and enjoy what he loves doing the most.
It's making sure I stay on the right side of the grass. I feel that Dr. Hirsch, Dr. Sung, Dr. Kim are all enabling me to be able to live my life to the fullest. I still feel I have a lot to live for. I've been a blessed man.
When Barbara arrived at National Jewish Health, we did a comprehensive evaluation. Her chest CT scans looked very normal. So that started us thinking about autoimmune diseases which can impact lung function without causing damage to the lungs. Our immune system ordinarily is designed to protect us. And an autoimmune disease that gets turned on its head and the immune system starts to attack the body. So we started to focus on this relatively rare disorder called shrinking lung syndrome.
So I had a healthy lung, but my diaphragm had sort of become paralyzed in a way. It wasn't working. So if your diaphragm is not working, your lungs are not working.
In the case of shrinking lung syndrome, there's a medication called rituximab. Over the course of getting that therapy, her lung function really had bounced back to essentially normal.
I was so thankful she can do more with her life. She can play with the grandchildren more effortlessly, and all those things just make her heart sing.
You see the joy, you see the humor. I have more of my mom back.
I can go outside and look at the garden and just cry out of joy, feeling that if the garden is doing well, then that means I'm going to do well. It represents life.
There's a point that I think really sets National Jewish apart, and that's the holistic nature of their approach. As a parent, you could not ask for anything more than that for your child.
We try and make that personal connection to move beyond that sense of you're part of a medical machine.
I think it's really important that everything that Daryl has needed, we're there all under the umbrella of National Jewish Health.
This is a fantastic place. The clinicians are top-notch. The research is cutting edge, and we take a collaborative approach to personalized medicine.
National Jewish Health changed my life by figuring out what is going on so that I can continue to enjoy life with my family.
Nothing else matters if you can't breathe. If we can improve someone's symptoms, provide a cure for these diseases, it will be life-changing.
They recognize there's a problem. They're doing everything they can to help me. When you're ill, that means all the world to you. National Jewish Health really, really saved my life.
National Jewish Health, changing lives for more than 125 years.